The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.
Hello and welcome to the ASCO Guidelines Podcast series. My name is Shannon McKernin, and today I'm interviewing Dr. Suzanne Chang from the University of California, San Francisco, lead author on Anticonvulsant Prophylaxis and Steroid use in adults with metastatic brain tumors, ASCO and SNO joint endorsement of the CNS Guidelines. Thank you for being here today, Dr. Chang.
Thank you so much for this opportunity.
So first, can you give us a general overview of what this guideline covers and about the endorsement process?
Absolutely. So one of the things we've noticed, of course, is that the incidence of newly diagnosed adult patients with brain metastases is now estimated to be in the range of about 20 to 40,000 per year. And this has really been increasing because of several factors. And this includes improved imaging tools, the fact that there's an increase in the number of cancers that are prone to spread to the brain, and the improved survival of patients with cancer. And so the Congress of Neurological Surgeons have developed a series of guidelines on the treatment of adults with metastatic brain tumors that include systemic therapy as well as supportive care. There are two guidelines that address the role of anticonvulsant use and steroids in the care of patients with brain tumors. Specifically, the guideline questions were, do prophylactic anti-epileptic drugs decrease the risk of seizures in both non-surgical and post-surgical patients who are otherwise seizure-free? So these are patients who've never had a seizure. Does it make any sense to use these drugs? The second is, do steroids, which are commonly used in patients when there is increased mass effect and cerebral edema, can that help to improve neurological functioning or quality of life compared to supportive care or other treatments? And if they are used, what sort of dose should be used? So the process of endorsing these guidelines included an initial assessment by content evaluators from ASCO and members of the Society of Neuro Oncology, or SNO, Guidelines Committee. And subsequently, it was determined that a detailed review of the guidelines should be pursued. So in this joint effort of both ASCO and SNO, a multidisciplinary expert panel of medical and radiation oncologists and neurosurgeons, neurologists, and others providing care for adults with metastatic brain tumors reviewed the content to determine the appropriateness for endorsement by the two professional societies.
So what are the key recommendations of this guideline?
The key recommendations of the guidelines include the fact that routine use of prophylactic anti-epileptic drugs is not recommended for patients who are seizure-free, either in the non-surgical and post-surgical settings, and that steroids could be used when patients had mild, moderate, or severe symptoms that were related to mass effect in the brain. The choice of steroids that was recommended was dexamethasone, and the doses was about 4 to 16 milligrams depending on the severity of the symptoms. And what they found was that there was insufficient evidence to recommend steroid use in asymptomatic patients when they didn't have any mass effect. And one of the additional aspects that the panel provided was that the minimal effective dose should be used and that nighttime doses should be avoided. And this is because of the known side effect of insomnia that a lot of our patients experience when taking this medication right before they go to sleep.
So why is this guideline so important, and how will it change practice?
Well, these guidelines provide a basis for oncologists to avoid the overprescription of anti-epileptics and steroids in patients with brain metastases, particularly in those who are asymptomatic and those without signs of mass effect. It also highlights that if steroids are going to be administered, that clinicians should be very familiar with both the short and long-term sequelae of steroid therapy, and they should have a plan to taper the steroids as fast as can be clinically tolerated.
So finally, how will these guideline recommendations affect patients?
Well, both anti-epileptics and steroids have a wide range of toxicities that can adversely affect a patient's quality of life. And so the routine use of these drugs in patients with incidentally discovered or asymptomatic brain metastases is not supported by the available medical literature. For patients with symptoms related to mass effect, the best evidence supports the temporary use of steroids at the lowest effective dose with the intent to taper them off, and if tolerated, and after a definitive treatment of brain metastases has been initiated. And because of the well-known side effects of insomnia and agitation, nighttime doses of steroids should be avoided. So the hope is that this will have a direct effect on how we care for our patients.
Great. Thank you for your work on these important guidelines, and thank you for your time today, Dr. Chang.
You're very welcome. It's such a pleasure to be able to provide this for patients and families.
And thank you to all of our listeners for tuning into the ASCO Guidelines podcast series. To read the full guideline, please go to www.asco.org/neurooncology-guidelines. And if you've enjoyed what you've heard today, please rate and review the podcast and refer the show to a colleague.